My name is Watisha Buckles. This is fall 2024. Today is October 27, 2024. This is my head-to-toe assessment. I am scanning the room. And also the floor. And the ceiling. I'm beginning my assessment by assessing my patient's skin on the head and face and neck, anterior chest and posterior chest and abdomen, for color, for temperature, for moisture, for texture, for edema, for turgor, for bruises, scars, lesions, and nevi. I'm also inspecting my patient's head for size, symmetry, and midline. Head is normal, cephalic, and midline. I'm palpating my patient's head and scalp. The hair color is dark brown. The texture is soft, even distribution. Also palpating for masses, tenderness, depressions, lesions, and infestations. Next, I'm palpating my patient's temporal arteries. I am palpating his lymph nodes, preauricular, postauricular, occipital, tonsillar, submandibular, submental, anterior cervical, and posterior cervical, and supraclavicular. I'm palpating for TMJ, open and close your jaws. There you go. No subluxation, no crepitus, no tenderness. Now I am assessing cranial nerve 5, which is the trigeminal nerve. I'm going to assess first for motor and then for sensory. For motor, I need you to clench your jaws. I'm palpating his masseters as he clenches his jaws. You can relax. Close your eyes, please. Tell me what I'm touching.
Forehead, right cheek, nose, chin.
Cranial nerve 5 is intact. Now I'm assessing for cranial nerve 7, which is the facial nerve. I need you to smile, frown, raise your eyebrows, puff out your cheeks, and pucker your lips. Cranial nerve 7 is intact. Now I'm going to assess my patient's ears. I'm checking for shape and position. I'm also palpating his tragus and pinnae for masses and for tenderness. Now I'm going to use my otoscope and assess his auditory canal and tympanic membrane. Auditory canal on the right is patent. Tympanic membrane, pearly gray, will cause a light reflex at 5 o'clock. On the right, auditory canal patent, tympanic membrane, pearly gray, positive light reflex at 7 o'clock. Next, I'm going to assess cranial nerve number 8, which is the auditory vestibular nerve. For the whisper test, the Weber test for lateralization, and also the Rene test for air and bone conduction. First, I'm going to start with the whisper test. Cover your right ear. Repeat what I'm saying.
1, 2, 3.
Okay, now cover your left ear.
1, 2, 3.
Now I'm going to complete the Weber test. Can you hear the vibration more on the right, left, or in the middle?
Middle.
Okay. And now the Rene test on the right. Can you hear it?
Yes.
Can you hear it?
Yes.
All right. And on the left, can you hear it?
Yes.
Can you hear it?
Yes.
All right, cranial nerve 8 is intact. Now, I am assessing my patient's eyes, looking at his brows, his lashes, palpebral fissures, assessing his sclera and conjunctiva, sclera white, conjunctiva pink. There are no lesions and there's no discharge. Now, I want to assess cranial nerve 2, which is the optic nerve. for gross visual acuity and peripheral and central vision. Cover your right eye. Read the smallest line you can see.
CFDHJ.
Okay, now your left eye.
CFDHJ.
Now read with both eyes.
CFDHJ.
Okay, patient's vision is 20/25. All right, tell me when you can see my hands.
I can see it.
Peripheral and central vision are intact. Now I'm going to test for accommodation and convergence. Look up there at that point on the wall and follow my finger in. Accommodation and convergence are intact. Now I want to assess cranial nerve 3 for pupillary response. Open your eyes for me. Pupils are equally round and reactive to light and accommodation. Pupillary gauge is 4. Cranial nerve 3 is intact. Now I want to, and cranial nerve 3 is the oculomotor nerve. I want to now assess cranial nerve 3 again, the oculomotor nerve, along with cranial nerve 4, the trochlear nerve, and cranial nerve 6 for extraocular movement. Using the 6 points on the visual field, I want you to follow my finger. Cranial nerves 3, 4, and 6 are intact. Now I'm assessing red reflex. Look up there, keep looking, and I'm looking for the red reflex of the light, and I'll follow into his eyes, looking at the internal eye structure on the right. Margins are sharp, no AV nicking, no woolly bodies. On the left, margins sharp, no AV nicking, no woolly bodies. Now I'm assessing my patient's nose. It is midline and it is straight, and I'm going to assess cranial nerve 1, the olfactory nerve, and for smell, and the nasal patency at the same time. Close your eyes. Close one of your nostrils. What does this smell like?
Perfume.
What does this smell like?
Echo.
Okay. Close the other nose. Other side, your other nares. What does this smell like?
Cream.
Okay. Cranial nerve 1 is intact, and both nares are patent. And now I am palpating his frontal and maxillary sinuses. I am now assessing his mouth, starting with his lips, teeth, buccal mucosa, and gums. Open your mouth. Looking at his palate, his tongue, his salivary duct. Lift your tongue up. Okay. Stick your tongue out. I'm looking at his posterior pharynx and his tonsils. I'm also assessing cranial nerve 9, the glossopharyngeal nerve, and cranial nerve 10, the vagus nerve. Say ah.
Ah.
Cranial nerve 9 and 10 are intact. His uvula and soft palate rise symmetrically with phonation. Lick your tongue out. Move it up and down, side to side. I just tested cranial nerve 12, which is the hypoglossal nerve, and its intact. Tongue is midline without fasciculations. Next, I am looking at my patient's neck. I'm palpating his trachea, and now I'm going to palpate his thyroid. I push to the left, swallow. Okay, push to the right, swallow. Now I'm palpating his carotid arteries, and I'm going to auscultate his carotid arteries for breathe. Next, I'm going to inspect my patient's posterior chest. Turn that way for me, please. Turn that way. I'm assessing him for signs of respiratory distress. That includes tripod position, nasal flaring, use of accessory muscles, tachypnea, retractions, and symmetry. Now I'm inspecting his posterior chest for deformities and for symmetries. I am palpating for symmetrical chest expansion. Now I'm going to palpate for tactile primitive, say 99.
99, 99, 99, 99.
Now I'm going to percuss his posterior chest. And now I'm going to auscultate his posterior chest, starting above his scapula. Make sure that I include his right middle lobe and his basis. Now I'm going to auscultate for bronchophony, say 99.
99, 99, 99, 99, 99, 99, 99, 99.
Egophony, say E.
E, 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 E.
Now I'm going to assess whisper pectorially. Whisper 1, 2, 3. Okay, while I have my patient in this position, I'm going to go ahead and assess for CVA tenderness, which is part of the abdominal assessment. Negative for CVA tenderness. Okay, turn back around for me, please. I'm assessing his anterior chest for deformity and symmetry. I am palpating for symmetrical chest expansion, and again, I'm going to palpate for tactile primitive, say 99.
99, 99, 99.
Next, I am going to assess my patient's heart. I'm going to auscultate over the 5 points, first with the bell of my stethoscope, then the diaphragm. The aorta is in the right second intercostal space. Pulmonic is in the left second intercostal space. The Ehr's point is in the third left intercostal space. The tricuspid is in the fourth left intercostal space, and then the mitral is in the fifth left intercostal space. Again, aorta, pulmonic, Ehr's point, tricuspid, and mitral. Now I'm palpating for the PMI, and I'm auscultating his apical pulse for a minute. His pulse is 67, rate of 67 with a regular rhythm. Now I'm going to have my patient to lie back at about a 30 to 45 degree angle. I'm looking for jugular vein distension. There's no heaves, no lifts. I'm palpating the 5 points again for thrills. Again, that's aorta, pulmonic, Ehr's point, tricuspid, and mitral. Now I'm going to have my patient to lie supine while I auscultate those same points again, first with the bell of my stethoscope, and then with the diaphragm. That's aorta, pulmonic, Ehr's point, tricuspid, and mitral. Again with the diaphragm, aorta, pulmonic, Ehr's point, tricuspid, and mitral. And while I have my patient in this position, I am inspecting his abdomen for contours and for symmetry. Once I do that, I am auscultating his abdominal arteries, the aorta, the renal arteries, the iliac arteries, and then his femoral arteries. After that, I'm auscultating all 4 of his abdominal quadrants for bowel sounds, starting with the right lower quadrant, right upper quadrant, left upper quadrant, left lower quadrant. Now, I'm going to percuss over those quadrants. And now I'm palpating those same 4 quadrants again for masses and tenderness. I'm palpating for my patient's liver. Take a deep breath. Let it out. I palpated the border of his liver. That's normal. And now his spleen. Take a deep breath. Now breathe out. Okay. Now sit up for me. Now I am assessing my patient's his hands and his wrists, his elbows, and his shoulders for redness, for swelling, for deformity, for tenderness, for nodules, crepitus, and for symmetry. Now I'm palpating his capillary I'm palpating his capillary refill, and it's less than 3 seconds. I'm palpating his radial arteries. Now I'm going to assess the range of motion in his fingers. Do what I do with my hands. We're going to flex, extend, hyperextend, abduct, adduct, thumb opposition. Now with the wrist, we're going to flex, extend, hyperextend, radial deviation, ulnar deviation, rotation. With the elbows, we're going to flex, extend, and hyperextend. Now I want to assess my patient's strength in his hands. Squeeze my hands, touch your hand, don't let me go. You can let go. His grips are 5 out of 5. Bend your arms for me. Don't let me push your arms in. Don't let me pull them out. Strength 5 out of 5 for flexion and extension. And the shoulders, don't let me push your arms in. Good. Don't let me push them out. Strength for abduction and abduction of the shoulders is 5 out of 5. Now I'm assessing cranial nerve 11, the accessory nerve. Don't let me push your shoulders down, shrug up. Okay. Cranial nerve 11 is intact. Now I am assessing the overall skin of my patient's upper extremities and lower extremities for warmth, color, integrity, and for edema. I am also assessing my patient for stereognosis. Close your eyes for me. Hold your hands out. For stereognosis and gravesthesia. Tell me what letter I'm writing in your hand.
T.
And tell me what number I wrote in your hand.
2.
Okay. What object is this?
Key.
Okay. And what object is this?
Quarter.
Okay. I'm also assessing for sensory. Tell me if this is sharp or soft.
Sharp. 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 Soft.
Okay. You can open your eyes. Now I'm going to assess for vibratory sensation. Hold out your wrist for me. Starting with the wrist. Can you feel it?
Yes.
Can you feel it?
Yes. Yes.
Okay. Can you feel it?
Yes.
Okay. And the medial malleolus. Can you feel it?
Yes.
Can you feel it?
Yes.
Okay. Now I'm assessing my patient cerebellar coordination with rapid movements. Repeat after me. Sudden finger opposition. Flip flop. Touch your finger take your finger and touch your nose and then touch my finger. Okay. Now I'm assessing deep tendon reflexes, starting with the brachial, radialis, biceps, triceps, patella, Achilles, and Babinski's. Next, I am assessing my patient's toes, ankles, knees, and hips for redness, for tenderness, for swelling, for deformity, for crepitus, for nodules and symmetry. I'm palpating his toes for capillary refill, less than 3 seconds. I am palpating his dorsalis pedal pulses. I am palpating his posterior tibial pulses. Now, I want to assess range of motion in his toes. I'm going to show you what to do. You're going to flex, extend, hyperextend, abduct, and abduct, adduct. And now with your feet, you're going to dorsiflex, plantar flex with both feet, please. Inversion, eversion, rotation. Now I'm going to assess the strength of his ankles. Push down on my hands, good. Now push up, good. Strength 5 out of 5. Next, his knees. Don't let me push your legs in. Okay, and don't let me push your legs out. Strength of his knees is 5 out of 5. And that was for flexion and extension. And now the hips for abduction and abduction. Don't let me push your all right. And now don't let me push it in. Strengthen his hips is 5 out of 5. I'm going to have my patient stand up now. Now, I'm going to go back and do a full assessment of the strength of his shoulders. We're going to flex, extend, hyperextend, abduct, adduct, circumduction, internal rotation, external rotation. And now we're going to assess his knees. We are going to flex, extend, hyperextend on the right. And now on the left, we're going to flex, extend, hyperextend. And now the hips on the right, we are going to flex, extend, hyperextend. We're going to abduct, adduct, and circumduction. Internal rotation, external rotation. On the left, we're going to flex, extend, hyperextend. We're going to abduct, adduct, circumduction, internal rotation, external rotation. Now, I'm going to have my patient bend over, and I am assessing his spine for expected curvature, for alignment, and for scoliosis. I'm also having him in this position for assessment of his lateral spine as far as flexion. Now straight up, this is extension. And then side to side, that's lateral flexion. Twist, that's lateral rotation. And now for his cervical spine, we're going to flex, flex, just your chin, bring your chin, bring, flex, extend, hyperextend, lateral flexion, rotation, rotation, bend your side to side, rotation. Now, I'm going to have him close his eyes so I can assess for Romberg. I will do this for 30 seconds, and I notice that he's not swaying. Now, I'm going to have him to open your eyes, walk towards the camera. Okay, now turn around, come back, heel to toe. Heel to toe. Like this. Okay, turn around, hop up and down on one leg at a time. Now the other one. And that is my head to toe assessment.